Hi, I'm Linda and I'm an occupational therapist, and today I'm going to talk to you about hypersensitivity and some desensitisation techniques that you can use to manage the hypersensitivity. So sometimes after an injury, the body's sensory system can become abnormally sensitive or painful. This can happen even if the injury or the damage is very small or superficial. Scars quite commonly become hypersensitive, but equally it doesn't necessarily have to be a scar that is the problem. So when the body becomes hypersensitive, it can be really painful or unpleasant to touch that area. It might make you feel a little bit sick or nauseous. You might even feel a bit anxious about touching the sensitive area and want to avoid anything touching it. Sometimes you might find that even just thinking about touching the area can make it feel more painful and unpleasant. So desensitisation is a way that we can start to return the body to a normal level of sensitivity by re-educating the sensory system of the body. And there's quite a few ways that you can do that, and it's finding the way that it's the most comfortable for you and the one that you have the most confidence using. So the first one I'm going to talk about is massage. So imagining that this is the sensitive area of my hand here, and I don't like touching that area, you can use massage just simply starting by stroking across the area. If you start on the other side and think about what normal feels like, and then you can come over to the affected side and start stroking in the same way and trying to remember what normal felt like. You may not get to the sensitive part, it might just be too uncomfortable, but if you start by stroking around that area very lightly, and then over time you should find that you can start to come onto the sensitive area. It might take several attempts or even several days to be able to do this. Some people find that light touch is really exacerbates the hypersensitivity, and they prefer a firmer pressure, and that's fine. You can start to just sort of massage quite firmly, firstly on the unaffected side, thinking about what normal feels like, and then starting to come over to the affected side, pushing and massaging. Sometimes using cream can help. So if it feels a little bit too uncomfortable just to do it with your fingers, you can just use cream and massaging that in, because the fingers glide more easily over the skin. You've got the sensation of the cream, it might feel quite cool. If you get a nice smelling cream, that's sort of sending positive messages to the sensory system that it doesn't need to be sending all these horrible feelings to that part of the body. If you prefer, you could get somebody else to do the massage for you. Again, starting on the unaffected side and moving over to the affected side. You need to be able to trust that this person isn't suddenly going to go over to the area that you're not comfortable with. So you may prefer to just do it on your own at first and then get somebody else to do it when you feel a bit more confident. Everybody's different, so you need to find the way that works for you. Okay, so another way that you can start to desensitise sensitive areas of the body is by using different textures. What you need to do is just find some everyday objects of varying textures. So things like towels, I've got a pillowcase here, piece of tissue, I've got some wool, a shirt and a hand scourer. So it's for you to decide which you think you could tolerate even for a little time and which is a definite no-go. For most people, starting with soft textures is easier, but occasionally we get people that actually prefer rougher textures. So it's up for you to kind of decide your hierarchy, which you feel comfortable with, and which you want to work towards over time. So similarly to the massage, what you do is you select a fabric or a texture that you feel you could tolerate for a little while, and onto the other side of the body, the unaffected side, just start by gently rubbing over that area and thinking what that feels like, perhaps describing it to yourself. So this feels quite soft, slightly warm, and there's a bit of a papery feel. And then you can come over to the other side, and in the same way as you did with massage, start working towards the most sensitive areas. Not worrying if you can't get there straight away. It might take a few sessions and a few days to build up to that. But over time you should be able to tolerate it a little bit more and a little bit more. Anything that makes you pull away and feel like that is not a good place to start, because that's reinforcing all the negative sides of the hypersensitivity, and we want to try and increase the confidence of the nervous system that this paper towel is not something that's going to do you damage. So once you're quite confident with the first couple of textures that you've chosen, you might want to upgrade to something slightly more difficult. So I've chosen this towel, so again, just starting on the other side, thinking what it feels like, describing it to yourself, and then coming over to the affected side and trying to remember those feelings, perhaps even repeating the words to yourself as you're sort of massaging towards the affected side. Okay? You don't want to do this too often. Little and often is the key. If you're just massaging or using textures to the point that the body is getting really painful and uncomfortable, and if you're massaging too roughly and you're just causing bruising, that's all a negative benefit to the desensitisation. So doing it several times a day, just for a couple of minutes at a time, little and often, is the methods that get the best results for these techniques. Okay, so before we move on to looking at immersion techniques for desensitisation, I just want to reiterate a few do's and don'ts. So first of all, doing any of the techniques, it's important just to do it little and often, so you're not overstimulating the area and increasing the sensitivity. Whilst you're doing it, think about how the textures or the massage feel, and also look at the area whilst you're stimulating it, because this will increase the sensory information that's going to your nervous system. Always try and incorporate the normal side and think about what that feels like before moving to the affected side, and just do this in a place where you can feel relaxed and quiet. So don't rush it. If you're feeling tense and just want to get it over with, that's just reinforcing the negatives. If you don't stimulate the affected area for long periods, or if the pain is getting worse, stop doing it. Don't use textures or massage techniques that you can't tolerate and that make you want to pull away. And if you've lost concentration, if you find yourself looking out of the window instead of concentrating on what you're doing, then stop doing it and come back to it later. Okay, so shortly we're going to look at immersion techniques for desensitisation, but if you have any queries about anything we've talked about so far, just contact your therapist for clarification and advice. Okay, another technique that you can use for desensitisation is the immersion method. And in this method, you just need to find a variety of objects that you might find lying around the house. So we've got things like corks, sand, washers and nuts, and rice. And as with the textures, start with ones that you feel you can tolerate, that aren't going to make you feel like you need to pull away. You might want to start, first of all, just by sort of putting your fingers in, perhaps putting the object over and around the sensitive area, but not necessarily right on it. And like with the textures, you might want to start with the unaffected side and feel what that feels like. As you get more confident, you can get your hand further into the objects, so really immerse them, run them over the area, and then to make it even more difficult and to perhaps keep the hand in there for longer, you can hide small objects. So I've got some stones here that I'm going to hide in the sand, and then the patient can really have a good old root around in there and try and find the objects. You're also then having to try and identify the different objects by their textures, which is part of this whole sensory relearning process. All of the techniques we've talked about so far can be used on any part of the body. Hands and feet are particularly prone to developing hypersensitivity because they have lots of nerve receptors in them. So Elena is demonstrating here how to use the immersion technique with feet. So again, just a selection of everyday objects, rice, corks, polystyrene packaging, and some little games counters. She's rated them as to which she feels most confident using, and then she's just starting by immersing just perhaps the toes and then getting the foot in deeper and deeper and rubbing the material over the foot and the sensitive area. And as with the hands, you can make it more difficult by perhaps popping some other objects into the material, so a couple of stones, and then trying to find them with the foot. So you really have to get the limb in there and have a good feel about. Okay, so I hope you found that useful. And just to reiterate that the key to desensitisation is to do it little and often, and to try and incorporate it into your everyday activities. So some ideas for that are, if you're in the bath or the shower, just allowing the water to run onto the affected area, and again comparing it with the unaffected side. You might want to use a flannel or a shower scrunchie over and around the affected area, and then when you get out, don't just let the limb air dry, but pat it dry with a soft towel over and around the affected area. When you're getting dressed, try and allow clothing to touch the affected area, so as you're perhaps putting your hand and arm into a jacket or putting your socks on, and try and wear different textures and different types of clothing over the area so that they're getting exposed to as many different textures as possible. When you're in bed, allow the sheets to touch the affected area, and again, concentrate